Hi everyone, my name is Elliott Carlisle, and I am presenting my Keystone investigating the importance of familial autoimmune disease in children who are presenting with neuropsychiatric symptoms. Now imagine with me for a moment that you're a parent, and you put your cheerful, carefree, happy child to bed one night, just as you always do. But in the morning, you wake up and you're met with an anxious, angry kid. Your easygoing, go-with-the-flow child suddenly needs everything to be in a particular way. Their breakfast has to be cooked a certain way, their stuffed animals have to be arranged perfectly, and their clothes have to feel just right. Your independent, I-can-do-it-myself child is suddenly attached to mom and won't let you out of their sight. Your straight-A kid who came home from school yesterday with a big smile is now in tears at just the thought of getting on the bus. Your kid who gets along well with others and loves their siblings is now getting in fights out of the blue. You think, what is happening to my kid? So doctors may suggest a range of diagnoses, including obsessive-compulsive disorder, separation anxiety disorder, oppositional defiant disorder, or an eating disorder. Typical pediatric onset neuropsychiatric disorders typically present gradually and may increase in severity over time. They don't take on their most severe form in a child overnight. So what is happening to my kid, you ask? PANDAS, pediatric autoimmune neuropsychiatric disorder associated with streptococcal infections, which is your standard strep throat infection, and PANS, pediatric acute onset neuropsychiatric syndrome, are characterized by the sudden and acute onset of neuropsychiatric symptoms in youth, oftentimes following an infectious or environmental trigger. PANDAS originates from a group A strep infection, and symptoms must present before puberty. PANS, on the other hand, requires neither a specific trigger nor a specific age requirement. Both diagnoses do require the abrupt presence of OCD and often present with additional neuropsychiatric symptoms. So what causes PANDAS and PANS? Well, in short, we don't know. There's an ongoing debate regarding the etiology and pathophysiology for both conditions. One hypothesis suggests that PANDAS and PANS are potential autoimmune conditions or are related to a disruption in the immune system. This is based off of evidence that has found that autoimmune antibodies are present in patients with PANDAS. Furthermore, immunomodulatory treatments, that is, treatments that regulate the immune system, such as intravenous immunoglobulin, or IVIG, as well as anti-inflammatory therapies, including non-steroidal anti-inflammatory drugs such as Aleve, Advil, and Motrin, as well as both oral and IV corticosteroids, have shown efficacy in reducing PANDAS and PANS symptoms. In addition, current research suggests that immunological factors may play a role in other psychiatric conditions, with evidence pointing to a higher prevalence of autoimmune disease in both patients and relatives of those diagnosed with OCD and tic disorders. So due to the potential origins of PANDAS and PANS and evidence pointing to this potential association between autoimmune disease and neuropsychiatric symptoms, it's recommended to review family autoimmune history when screening for potential PANDAS and PANS. Existing clinical studies have reported elevated rates of autoimmune and inflammatory conditions in patients with PANDAS and PANS, but these current studies are limited by small sample sizes, lack of confirmed diagnoses, and a lack of a control group. In addition, no study has yet to compare PANDAS to PANS, which brings me to my current study, where I aim to answer the following 3 questions. First, what are the rates of familial autoimmune disease in a sample of youth who have been clinically diagnosed with PANDAS or PANS? Second, are the rates of familial autoimmune disease higher among youth who have received a diagnosis of PANDAS and PANS compared to a group of youth who are presenting with acute onset neuropsychiatric symptoms but who did not meet criteria for either diagnosis? And lastly, do the rates of familial autoimmune disease differ between PANDAS and PANS patients? To answer these questions, I have been working closely with Drs. Kyle Williams and Sarah Odor of Massachusetts General Hospital's Pediatric Neuropsychiatry and Immunology program, where I've had the opportunity to intern over the last 2 years. This program is the largest clinic by volume in the country that is dedicated to both researching and treating patients with suspected PANDAS or PANS. The sample for my study consists of patients seen in this program between 2018 and 2023 who, prior to intake, completed the caregiver report questionnaire assessing for familial autoimmune disease history, and who, upon intake, received a diagnostic determination from a psychiatrist with expertise in the field. Patients were separated into 3 subgroups: patients who received a PANDAS diagnosis, patients who received a PANS diagnosis, and patients whose symptoms did not meet the diagnostic criteria for either, the non-diagnosed cohort. In total, 141 patients were included in the study, 62 of whom had pandas, 30 with PANS, and 52 who did not meet criteria for either. Just over half of the sample was male, with an average age of about 12 years old, and the vast majority of the sample was white and not Hispanic or Latino. All data was transferred from StudyTracks, an online HIPAA-compliant database, and analyzed using SPSS statistics. There were two primary findings from our study. First was that all three subgroups endorsed an assorted range of autoimmune conditions among their first-degree relatives. As you can see in this graph here, any history of at least one autoimmune disease among first-degree relatives was reported in just over 30% of PANDAS and PANS patients and just over 40% of the non-diagnosed cohort. As you can see in the bottom line of this graph, these numbers appear quite elevated when looked at next to the prevalence of autoimmune disease in the general United States population. So due to the study design, we could not collect data on family members of individuals without neuropsychiatric conditions, and so we didn't have this true control group. However, we can borrow from the current literature, which suggests about a 3% prevalence of autoimmune disease in the general population. So as you can see, our prevalence rates in our sample are quite elevated when compared to that rate. In addition to investigating the overall rate of autoimmune conditions, we wanted to look at some specific diagnoses, the most commonly reported of which were psoriasis, Hashimoto's, celiac disease, and rheumatoid arthritis, all of which also appear to be elevated when looked at next to this general prevalence rate. So in addition to looking at the prevalence rates, we also wanted to compare the rates between groups. And this leads me to my second finding, which is that no significant differences were found in the overall rate of autoimmune disease between any of the groups. That is, between the PANDAS and PANS in the non-diagnosed group and between PANDAS and PANS. So when looking at this comparison between groups, there are a few findings that I would like to point out specifically. First is that, as you can see, the non-diagnosed subgroup reported a higher overall prevalence of autoimmune disease. The PANDAS and PANS group more frequently endorsed a select few autoimmune conditions, including psoriasis, Hashimoto's, celiac, and rheumatoid arthritis. On the other hand, the non-diagnosed cohort endorsed a wider variety of autoimmune conditions, including type 1 diabetes, Crohn's, Graves', ulcerative colitis, lupus, and Guillain-Barré syndrome, none of which were endorsed by the PANDAS and PANS group. So what do these results mean? Well, initially we hypothesized that there would be differences in familial autoimmune disease history between children who received a diagnosis of PANDAS and PANS and non-diagnosed children presenting with sudden onset neuropsychiatric symptoms. But that is not what we found. What appears to be more interesting is that as a whole, regardless of subgroup or diagnosis, children presenting with these acute onset symptoms may have a greater family history of autoimmune disease. These findings contribute to current research that is investigating this potential association between immunological factors, including autoimmune disease and neuropsychiatric disorders, and aids to the literature suggesting a potential autoimmune hypothesis for PANDAS and PANS. So given that we did not find significant differences between groups and the hypothesized connection between autoimmunity and the development of neuropsychiatric conditions, it is worthwhile for clinicians to evaluate for family autoimmune disease history when screening patients for neuropsychiatric conditions, and this is not something that is currently standard practice. So in summary, researchers should continue to explore the potential autoimmune and genetic risk factors contributing to the development of neuropsychiatric symptoms in both adult and youth populations. And I'd like to give a special thanks to my advisor here at BU, Alyssa Farley, as well as Sarah Odor and Kyle Williams at Mass General, none of whom this would be possible without. Thank you.
Elliott, now on to the Q&A. Don't be shy.
Thanks, Elliott. Since the population you studied is predominantly white, do you expect any different results by race?
That's a really interesting question. I'm not sure. I think especially because PANDAS and PANS right now are currently quite controversial diagnoses, and oftentimes patients have to go to pretty extreme lengths to seek out care. It may be that like these more predominantly white populations are able to seek out and get the correct diagnosis. So I think as more evidence is, or more providers are sort of accepting of these diagnoses, that there might be more research regarding those differences.
Thank you, Elliott. This was awesome. My question is, you were talking about autoimmune as a hypothesis. Are
Yeah.
there any other hypotheses behind pandas and pans, or like any other research around it?
Yeah, so there are a few hypotheses right now. So one of them is that there are potential autoimmune conditions. There's also evidence looking into whether pandas and pans are caused by inflammation in the brain, so looking at MRI and things like that. But it's tough because there's currently no like blood test or like even an MRI that can tell what that can confirm a diagnosis. So there are quite a few different hypotheses.
Hi, Elliott. I'm just wondering if understanding this in terms of autoimmune disease, does that change the treatment?
Yeah, so it definitely might. So with these conditions specifically, with looking at like the immunomodulatory treatments, if it is expected to be suspected to be an autoimmune condition, some of those more immunomodulatory treatments would probably be more effective. And if there's sort of strong evidence that it is an autoimmune condition, it could make those treatments more readily available. Because like I mentioned with the immunomodulatory treatment IVIG, it's very, very hard to get those treatments for patients with pandas. And so a lot of them are doing patients who are receiving that treatment, get them through clinical trials. And so hopefully if this hypothesis does get confirmed, then those treatments would be more readily accessible to those patients.
All right, thank you, Elliott.
Thank you.